Hi, this is Dr. Duresti with the cranial release technique. I'm going to do something a little different today than my normal type of video. I wanted to review some anatomy with you. And we'll start off with this side view of the cranium here. And actually, before we get started, if you wouldn't mind subscribing, liking, and sharing the videos, and this way we can get this message out to more people throughout the planet. And that's the whole point of this. So when we look about the great questions that have come up in the history of man and woman, one of them, of course, is which came first, the chicken or the egg? But then another question that came up at one of our seminars with one of my students that mentioned to me, does the Dura Mater matter? Now, it's a bit of a tongue twister, but I want to talk a little bit more about the Dura Mater, what it is, and why it's so important in the world of cranial release technique. So here's a picture of the cranium, colored view showing all the different bones, side view, right? And okay, we know there's 22 bones, and you've seen in all my other videos where I have the Hoberman sphere, there's 22 bones, and the theory is those bones never fuse, and the theory is because those bones need to move, and that movement is vital to optimizing central nervous system health, the brain, the spinal cord, and the whole body needs to rhythmically pulse secondary to the cranium. So, of course, the purpose of cranial release technique is to open, align, and restore motion to all these cranial bones. Okay, I think we've sort of covered that before. Let's dig a little deeper and talk about the Dura Mater. And I'm going to blow this figure up in a moment, but I just want you to understand, here's a lateral view looking sideways of the brain covered with the Dura Mater. Actually, they spelt it wrong. It should be M-A-T-E-R, but whatever, I didn't make the website up. The cranial Dura Mater is a thick layer of fibrous, dense connective tissue that surrounds the brain, covering all three cranial foci, and continues with the spinal meningeal dura over the foramen magnum. The foramen magnum is the base, the hole in the bottom of your head where the spinal cord is going to pass through. By lining the interior of the skull, the cranial dura represents a form of periosteum termed endosteum. So when we blow this picture up and take a better look here, again, this is the cranial dura. So this is if you remove the 22 cranial bones. Before you hit the brain, you hit the Dura Mater. If you're looking at this, hopefully you'll see that the patient would be facing the same way that the plastic model was before. So just so we're all clear and on the same page, that would be the direction of the skull. And now here's the Dura Mater. The outermost connective tissue covering of the brain, tougher than bone, stronger than bone, protecting the brain against trauma. Physically part of the 22 cranial bones. The way I used to explain it, like wallpaper on the wall, firmly attached to the inner surfaces of the cranial bones. And so the whole reason of this little video today is that as the cranial bones shift, twist, rock, you look at a patient, you see one eye smaller, one eye lower, one ear lower, ears are rotated forward or back, distortion at the maxillary arch, distortion of the jaw when someone speaks. All of that distortion is now taking place in the cranial bones, affecting the dura, affecting the spinal cord, affecting the entire central nervous system, which controls everything in your body. And in addition to that, that distortion of the cranial bones is impeding, it's negatively impacting the normal mechanism of the primary respiratory mechanism, Dr. Sutherland's primary respiratory mechanism. So when a patient gets on the table and you apply the cranial release technique, which again takes about a minute, we're opening, aligning, and restoring the motion to the cranial bones. In addition to that, we're now relieving tension on the dura mater. The brain is going to be much happier with less tension of a structure that's basically as tough as bone, that's twisting in and tightening down on it. That's why it makes so much sense, without going into any more detail, why we all should be receiving the cranial release technique on a regular basis. If you're a practitioner and you'd like to learn more about this, and I get into this in a lot more detail in the modules in the seminar, please click on the website, cranialrelease.com. Matter of fact, I have it right here. So there's the website, cranialrelease.com is the URL. From here, you can click on Online Training Program, and that will take you to a new page. And from there, you can learn more about some information, take a look at some of the different things that we're doing, take a look at, of course, at the online training program, watch some other videos that we have, and learn more about how you as a chiropractor, as a medical doctor, as a physiatrist, as an orthopedist, as a neurologist, as a physical therapist, as a massage therapist, occupational therapist, acupuncturist, whatever it is you do with the patient on the table, when you put hands on, they would greatly improve with the addition of cranial release technique, in addition to what you're currently doing in your normal routines, whatever type of practitioner you happen to be. If we just go back again, for those of you that are not practitioners and you're out there and you're saying, gee, maybe cranial release would help me, well, you can go and click on a button here called Find a Practitioner, and you can take a look on the website and see if we have anybody in your area, and hopefully we do, so that you can get on the table and experience this. Again, it is literally a 1-minute technique. It helps optimize central nervous system, the brain function, helps optimize every other system in the body, because the first thing we learned in school was that the central nervous system controls and coordinates every function of the body. So regardless of what it is that's not right with you, that you feel something's not right, or that you just like to enhance your current good health, cranial release is a winner. I think you should take a look at it, cranialrelease.com. This is Dr. Duresti signing off. Happy Sunday to all of you out there, and I wish you a great weekend, and we'll be in touch shortly. Thank you so much. Have a great day. Goodbye. Does the Dura Mater matter? I think it certainly does. The chicken or the egg? We could talk about that another time. Does the Dura Mater really matter? It absolutely does. Cranial release. See you soon. Thank you.